Yeah, so Reese was born at 22 weeks and 5 days, and so extremely premature. And looking historically, even a few years ago, most NICUs around the country would probably not even consider resuscitation. And as we have gotten better and technology has gotten better at caring for these extremely premature infants, we have moved the bar. And so Reese fell into that category where she was one of our youngest patients that we resuscitated and cared for. And it's a long road even after that initial delivery day. Like you said, she was in our NICU for a long time. She had to be on the ventilator with a breathing tube for about a month and a half. And even after that requires pretty intense respiratory support for a long time before we're able to wean off that. Babies born this early, aren't ready. They're born with skin that is pretty much see-through. And so all aspects of their medical care are important. And so from breathing to slow introduction of feedings to needing, long-term IV access with parental IV nutrition, to scanning her heart, keeping a close eye on her eye development, all of the systems are extremely premature and have to be monitored very closely. And the goal at the end of the day is to go home with a low risk of neurodevelopmental delays. We do brain MRIs as she gets closer to going home because, all of those things are at risk for developing poorly if not taken care of appropriately. And she's definitely a huge success story in that, she was able to be discharged from the NICU with a good outcome looking into the future. And that's pretty awesome.
All right. Thank you, Dr. Sitzman. We appreciate that. Next, I'll ask Callie a question. Callie was a NICU nurse that was with Megan and Reese from the day that she arrived until the day that she was discharged on November 2nd. Callie, what was it like to take care of Reese and Megan and just share some of your experiences and what an incredible success story this is, again, kind of based on your years of experience in the NICU?
Yeah, I've been in the NICU for 14 years and she is definitely the biggest success that I have witnessed. It was amazing getting to care for them. I was there the day that she was born, took care of her right after she was born, was there to see her walk out those doors 144 days later. And I mean, she is a true miracle, and just getting to be with her, for the majority of the shifts that I worked, and, really getting to know Megan and Dylan and baby Reese is just incredible. And, we're there at the bedside 24 hours a day as nursing staff. And we have what's called primary care nursing. And I was one of our primary nurses. And it's just very beneficial to be able to have the primary care nursing because we really know like any changes with the babies, we are, really on top of that and that type of stuff. So she's a miracle and I love that family dearly. So.
All right. Thank you, Callie. Very well said. Okay. And last, but certainly not least, Megan, this is probably the hardest question, and it's impossible to sum up your journey in one soundbite, but if you could just kind of talk to us about, your stay in the NICU, sum it up for us, and then how you felt when you were able to go home and leave with a healthy baby.
It took a lot. I wouldn't have been able to do it without my primary nurses. It was definitely a very long stay. I made it my home as much as I could. It had its ups and downs, but definitely having the support system with all the nurses and doctors and always communicating what was going on with Reese was a big part to know that I was getting reassured, even though she had the low percentage chance of survival, that each week or day by day, every day that she made it that the next week it's a higher percentage of chance that we get to take her home. So it took a toll on me, but I'm glad and thankful that I get to take my baby home.
All right. Thank you very much. Media, if you have any questions, feel free to type those in right now, or even unmute yourself. I do want to make mention that, and I don't know if Megan, if you want to say anything about this, but so Reese was a twin with Riley. They were born on Saturday, June 12th. Sadly, Riley passed away 12 days later, but she was with baby Reese throughout her whole stay. And I want to make sure we mention that because that's a very important part of the story as well. Megan, I don't know if you want to add any comment on that about how difficult that situation was and how you worked through that, and anything you want to offer on that.
It was very difficult. Of course, losing a baby isn't always easy. It was definitely hard thinking that since I lost a baby that I could potentially lose another one. It was very hard to stay connected with everything and just trying to be there in the moment. Knowing that I lost a baby. And then I'm just so thankful that I got to take her home.
Thank you, Megan. I know it's not easy to talk about that, so just feel to take your time. We did have a couple questions come in from the media, so I can kind of facilitate those. This one looks like it's a good one for Dr. Sitzman. So Austin has a question. Dr. Sitzman, for comparison, can you recall what the longest NICU stay was before Reese? And then what is the average NICU stay for a family?
Yeah, I'm not sure the exact day, but we have plenty of babies that, break that 100-day mark. We take care routinely of babies born at 24 or 25 weeks gestation, and they're typically there close to their due date. And so I'm not sure what the actual record prior was. It's not exactly a record we usually keep track of, but we break that 100-day mark quite often. The average stay is probably close to a week. We have a really varied population in the NICU of who has to come to the NICU and how long they stay. And, some babies that are born, that the limits of viability close to 24 or 25 weeks, they're there for that 100+ day, but that's in stark comparison to potentially an infant that has to come down because their jaundice level is too high and just needs a day or two of phototherapy. Those are very different types of populations. And so even though I'm sure I could pull our average length of stay, it really doesn't mean anything to me or to parents when a baby comes in born extremely premature. That average length of stay doesn't apply anymore at that point. So.
Okay, thank you, Dr. Sitzman. Questions are flowing in, so I'll just kind of take them in order. So Bailey from 1011 was wondering, can you give a little bit of background on why Reese and Riley were born so early? This could be maybe for any three of you, but maybe Dr. Simpson, if you want to start about the medical diagnosis part of that.
I need my cheat sheet.
That's okay. Yeah, go ahead. Yeah. So I believe the medical diagnosis was uterine diddleface. I'm probably not pronouncing that right, but it's a rare condition in which a woman grows two uteruses instead of one. So Megan conceived a baby in both her right and left uterus. So if you want to offer Dr. Sitzman or Callie any further on that, just talk about how rare that is, and does it typically lead to premature birth? We'll start with Dr. Sitzman.
Yeah, it's a rare condition, and that is more on the obstetric side of things. It obviously complicates the pregnancy, and when babies in that particular situation are having distress in utero, our likelihood to intervene sooner is higher, knowing that the risk of complication moving forward is higher. And so I'm not sure exact numbers, but it is a rare condition, and it obviously makes the pregnancy more complicated. And Megan therefore was likely seeing maternal fetal medicine specialists throughout her pregnancy, which just put her at higher risk to even begin with.
And Callie, you want to offer anything? Have you ever seen this type of case before in your 14 years?
I honestly didn't even know it existed until I met Megan.
So it is very rare. Okay,
it is very rare.
All right. Next question, we'll go back to Dr. Sitzman. I don't know if you know the details on this, but the question is, what were the initial APGAR scores? And this one may be a little more applicable. Can you just describe the challenge of caring for premature babies with multiple medical issues? How is that challenging for you and your team?
Yeah, so the ABGAR score is a score we assign at delivery based on a myriad of factors. And the max score you can get is 10. And I believe Reese got 1 initially. And that really just drives home the point that babies like Reese, when they're delivered, need assistance immediately. They cannot breathe on their own. Their heart rate cannot be sustained on its own. And I was there at the delivery, and we have to immediately put a breathing tube down. And as you can imagine, at birth, Reese weighed just over 1 pound. And so the size of the airway in those babies, is about the size of a straw. And it takes a lot of skill to be able to put the breathing tube down in its appropriate position to breathe for Reese. And after we do that, things start lining up easier. But putting down that breathing tube is step one. Some babies are just too small, but we were able to get it in Reese, and following that, securing IV access through her umbilical cord is really the next step. And so that's what we did next, because she can't tolerate feedings. And so she needs nutrition, which we administer through the IV line in her belly button, basically. And so that's really the first steps after her delivery.
All right, thank you very much. This question is for you, Callie. This is from Bailey at 1011. What were those moments like for you when you first started caring for Reese after she was born? And how does that compare to now, seeing a healthy baby right there? Just talk about that progress and that progression of what it was like from the first day that you met them to now.
Yeah, obviously the day she was born, fragile from the get-go. Baby's born this prematurely. She obviously defied the odds and had a very low percentage of survival at the beginning. And when you take care of extremely premature babies like this, it's emotional, because you leave your shift and you might not come back for a couple days, and you just hope to see their name still on the list of patients there at the hospital. And with each thing that she overcame, it was just astonishing to be able to witness that and celebrate that with her parents, and with Reese in general. And now I get to see her on the outside of the hospital and stuff. And get to we had a great friendship now that we have formed, and being able to see Reese on the outside whenever I want to now is just incredible. And knowing that she went through everything that she did, and she's here for all of us to witness. It's amazing.
All right. Here's a couple housekeeping questions for you, Megan. So can you let us know where you're from, where you live, and then also what is Reese's last name?
I was born and raised in Lincoln, Nebraska. Reese's last name is Martin. She has her dad's last name. My last name is Phipps. But yeah, she was also born here in Lincoln, Nebraska.
Okay, great. Here's a follow-up for you, Megan. So many parents go through the NICU. This is from Bailey at 1011. So many parents go through the NICU, whether it's for a week or months at a time. What advice would you give to those parents who are going through that journey or may have that journey in their future? What advice would you give to them about what to expect and how to handle it and deal with it?
The advice I would give is to be connected. There are other parents. I was obviously the longest stay on the NICU, so I got to see babies come and go while we stayed. I would say connecting with other mothers who are there. Everybody is new to it. Nobody expects what a NICU life could be. It could be a good experience or it could be a bad experience. Mine was bad that turned into good, and then I got to take a miracle baby home. They also offer psychiatry up in the NICU for anything that has happened to mothers of either losing babies that have to be transported to different hospitals to have surgeries. Talk to somebody. If you don't have the family support, I love my psychiatrist. He was there from the beginning, and he actually kept me as an outpatient, and I still see him. And he has given me the support and just everything that I needed to get through the NICU, on top of my nurses that were Reese and Riley's primaries. They got familiar with us. They learned all Reese's tricks when she was naughty. So it's definitely helpful to have somebody that knows you, knows your baby, and can relate to what NICU life really is.
Great answer. There's another one for you, Megan. This is also from Bailey. What kept you going through your 144 days in the NICU? And were there any major milestones that you celebrated and kind of welcomed and celebrated while you were here? I'm sure there were many, but any that stick out specifically that you could share?
She kept me going. I couldn't do it if it wasn't for her. The day that Riley had passed away, I actually went next to her isolette while I was holding Riley, and I had made a promise to her that as long as she kept fighting, that I would fight with her. And she did. And now look at her. Her biggest milestones were her weight and nutrition. It was always preached in the NICU, your baby's not going to get out of here without eating. So definitely the weight gains. Every weight gain that she would have, the nurses, doctors, nurse practitioners would make her these little collage things from their Cricut saying that their pound and that she was just doing good. Definitely her milestones were blood transfusions. That was a really big thing. She had a lot of blood transfusions that usually babies aren't supposed to have, like a lot of blood transfusions. And it's not like your typical blood transfusion. It has to go through processing and it has to be cleared through everything just to give to a preemie baby.
And a follow-up question from Bailey as well. What is life like with Reese now that you're home? What does that look like, and how much are you enjoying that? Obviously you are, with that big smile on your face.
I do miss my nurses. I have 2 older kids, so I know what it's like taking care of a baby at home, but it's different when you take home a sick baby who has needs that aren't necessarily normal like my other kids were. When we went home, she went home on oxygen, so we had to learn how to work all of her oxygen tubes and what do we do when we leave. And she had a heart and oxygen monitor. And with as long as the stay was, I was very involved with Reese and Riley from the get-go, even though how little they were. I've learned everything that the nurses did. I guess you could say that I wish I didn't have to go to school to be a NICU nurse. From learning from the best, I could just go up there and know how to do everything. And it actually helped me a lot going home. Reese now has a G button, which is a tube that helps with feedings. So she did graduate from oxygen. So now we are working on feedings. So it's just kind of learning everything and being prepared to go home.
Okay. Another question here for Dr. Sitzman. This is from Bailey. Dr. Sitzman, does Reese's case change anything about the way you approach your work or care for your patients, or maybe change your perspective or what's possible in your field? Just maybe talk about this experience and how it changed you as well going forward.
Yeah, it changes a few things in that, I described at the beginning that, it was only a few years ago when we wouldn't offer care for these babies and say that it was not in their best interest, and they were really just given back to their mom, and that was the end of it. And so now that bar has slowly moved, the next step is really identifying success stories, because if we resuscitate 22-week infant babies, and none of them survive, the NICU and staff and everyone involved and moms are not going to feel like it's worth it. And that, yeah, maybe the data say that they can survive, but we're not able to make that happen, or that their morbidity is so high, meaning that they go home on a ventilator or they go home with severe risk of cerebral palsy. Then also, what is the cost benefit? In stories like Reese, where there was big success and that her, she still has, hurdles to overcome moving forward, but in a big picture sense for a 22-week infant, she did awesome. And I think that's uplifting to the NICU and, makes our institution more cognizant. And because, in infants that are threatening to deliver that early, there are medications to give mom to prep the infant. And so we are a little more cognizant now as we approach these gestations in moms to start giving those medicines potentially earlier, knowing that, we are seeing success in this gestational window for these infants, and that giving moms these medications prior really puts their infant at, most highest risk for a good outcome. So it has changed things.
Great. Here's another question. I'll send this one to Callie and Megan as well. So maybe Callie, we can start this off with you. How did COVID protocols affect how Reese was cared for? Obviously, visitor restrictions to the NICU, limited people can come in and out, masking and things like that. So Callie, why don't we start off with you? How did the COVID protocols affect the way that you cared for baby Reese on the NICU?
Yeah, obviously, like you said, the masking and stuff, we kind of joked afterwards. Megan's mom knew me through my voice, and, never got to see what I looked like until, after Reese was discharged and we were able to, be on social media together and stuff. And like, oh, that's what these people's faces look like, because you just don't get to see that in the NICU. And yes, now with COVID, and I mean, even before COVID with cold and flu season, the NICU protocol is, just the parents or, the mom and their support person are allowed up in the NICU, really just, to protect these tiny infants. Their own children and the other babies on the NICU, by limiting all of those visitors that can come up. So.
And Megan, if you want to share, what was that like for you, not being able to have so many people, in a normal time, people can come visit, and even, like you said, your other children could have maybe come up and seen. So what kind of challenge did that play for you in the limited visitor policy and really having to be very particular about that?
It was hard. It put a strain on my kids. They never got to meet their sister for 144 days. We drove by the hospital every day that I dropped them off at school, and they would wave to the hospital and say, "Good morning, sissy," or they would always just ask how she's doing, or can we go see her? Everybody wanted to see her. It was hard, especially since the COVID rules are like, you can go eat in the lounge or you can just go hang out in your room. They used to have meetings for mothers that are in the NICU, but they had to stop it due to COVID, which I really think would be beneficial to other NICU mothers to get into a group of other mothers who are there and just kind of talk about what is happening with their baby, what are their struggles, what's going on. The biggest thing was I was scared to leave the hospital, and my nurses actually kicked me out and talked me into going home, to take a shower, to see my animals, to see my other kids. I was just so bound to the hospital. I didn't want to go on the outside, risk getting her sick or anything. So I moved my whole life into this room that my daughter was in for 144 days, just so I wouldn't get her sick. I remember the day that I did go home. I think it was the 4th of July. I went home and spent it with my kids, and I didn't come back to the NICU till like 2 or 3 o'clock in the morning, and they were like all worried about me. They were like, "Oh my God, you were gone for so long." And I was like, I know it was so hard, but now I'm back and I'm never leaving again. So it's hard.
All right. And another question for you, Megan. This is from KLIN. The story is primarily about Reese, obviously, but you were also a patient at Bryan, and with early delivery, you had your own serious medical conditions and issues to
Yes.
work through and deal with. So tell us about your whole Bryan Medical Center experience through all of what you've been through and the care that you received here. How was it?
I love it. I wouldn't have picked a better place. My oldest daughter was born here. My son came early and we were out of town, so he was an outer state baby. But my care with my oldest daughter, I loved the nurses when it became delivery time. They were just good about everything. And then the postpartum ward, just everything is good. I love Bryan East. After we went home on November 2nd, we actually had to get readmitted to UNMC on November 23rd. And that's when we found out that she had to get a G button. Not favorable, especially it being in Omaha and living in Lincoln was definitely a strain. But we definitely favor Bryan East. I would always talk to Callie, Becca, or Des, and I'm like, I wish I was back home. I wish you guys did surgeries here at Bryan East. Like, this is our home. Everybody knows Reese here. I just wish we could come back to the NICU. It's a really good place. Like, a lot of places that I heard don't do it for their NICUs, but they have like this thing that's called the caterpillar, and it's every milestone that the baby makes, from the first day that they're born to their first holiday, their feet prints, her first outfit, all of her blood transfusions. It's this giant caterpillar that states that she made every outcome that nobody thought was possible. And it's just a memorable thing. And then them getting to make her like these little collages with her primaries. The primary gets to take a picture with Reese, and they get to write a letter to her, and then we keep it until the day that she grows up and she gets to read it. So it's a really good experience. Nor do I want a mother go through the experiences that I have been through, but if you are here at a NICU, I would suggest Bryan East.
Thank you, Megan. A follow-up from that, from Bailey to Callie. It's a good question. Why do NICU nurses at Bryan go above and beyond to make those collages, those caterpillars? Just maybe talk about that and how important that is to the care that these babies and these families get.
Yeah, we are definitely very much about patient-centered care, and doing the primary nursing, the caterpillars, the scrapbook pages. It's just really something that the parents can look back on and recognize what their babies really went through in this journey. And as we're making them, we also are, able to see what our work has done, to be able to care for these babies as well. I'm a mother of 3 myself, and, I go into work every day, with the idea that if these were my babies here in the hospital, I would want these people to do the same thing for me as well. And so very much treating all of these families and babies as if they were the ones taking care of my baby. So